Breast cancer is the second leading cause of cancer death in women, yet many women still are not getting screened for the disease through a yearly or biennial mammogram. In tonight's SWISStrong report, we introduce you to one woman who said she simply got too busy to get screened, but when she finally did, it saved her life. Cindy Leweke-Brawner always knew how important it was to get a mammogram, but for some reason last year she just kept putting it off.
And every week or every month I put on my calendar, call for an appointment.
But 6 months went by and she still hadn't called.
Well, it got to be November. I thought, I have got to get in.
Her story isn't unique. According to a 2013 study by the Centers for Disease Control and Prevention, more than 40% of women in their 40s had not received a mammogram in the last 2 years. That number fell to just over 30% for those 50 and up.
Screening is important. I think it does save lives, and I think it does change the course of treatment if the tumor or cancer is caught early.
So why aren't women getting them? Several reasons, according to the Susan G. Komen Foundation. There are barriers when it comes to affordability, access to care, an inability to leave work or find childcare, fear of bad news or a painful procedure, or a general lack of knowledge and awareness about the importance of breast cancer screening. And in Cindy's case,
I just got so busy.
But there's also some confusion as to just how often women should be screened or when they should start, after a federal task force changed what had been widely accepted recommendations for yearly screenings over the age of 40, after comparing the benefits of cancer detection to the risks of false positives, emotional stress, unnecessary testing, and financial strain.
So there's some controversy. They do have recommendations to do screening starting at a later age, starting at age 50, or considering screening every 2 to 3 years between the age 40 and 50.
The recommendations continue to evolve, with many organizations like the American Cancer Society adopting its own screening guidelines.
So everyone is a bit different. I think we need to make sure we provide as clear information as possible to our patients because it is confusing.
For Dr. Kaluza, it's a patient-by-patient basis, but she tends to err on the side of caution.
You need to look at their risk factors, family history, genetics, their background. I tend to recommend yearly screening just because I feel that there's enough benefit to many of my patients for cancer being caught early.
As for Cindy, that mammogram she delayed for 6 months ended up detecting her breast cancer.
If I would have waited even longer, it probably would have grown.
After a surgery and 8 weeks of radiation, she is now cancer-free and has a message for anyone else putting off their next appointment.
Don't get too busy to do this because you need to go in. I would have, the area that they found, I never would have found by feeling anything.
Dr. Kaluza could not stress enough to us that the topic of screenings is really a conversation you need to be having with your doctor, and it should be decided on an individual basis. For more information on Sparrow's Breast Cancer Clinic, just head to our website and click on the SWISStrong tab.